At the end of the day, when all is quiet, even the busiest nurse may take a moment to reflect on her work.
I wonder if my work has a positive impact. There are so many families, and I have such hopes for them.
Now meet some public health nurses who also take a moment to reflect on their work and on their hopes.
When I was in nursing school, it was obviously important to get all of that acute care experience, but that was not the place I wanted to end up in my practice.
As a floor nurse, your patient is your primary focus, whereas public health, the family is your entire focus.
In the student nurse role, I really see the public health nurses or the case managers that I'm working with really kind of tying in and connecting everyone so we can get the support that is most helpful for the client.
But actually being able to go into the home and assess the mothers who these children come from. So I think public health nursing is great in that aspect. It gives me a full, well-rounded picture of what people's environments are like.
What's most appealing to me about public health nursing is to be able to build those long-term relationships with clients, to really be able to work with them in their own space, in their own whatever they call home.
And I also feel very honored by the trust that people put in by sharing with me very intimate and difficult family situations, that I was able to hold that information in a non-judgmental way, including between other family members.
So you assess the family, see the family's needs, and then you're able to link them to the different resources that are available in our county. And then also within, you can empower them into how to access those resources.
We are charged with the health of the community, improving those health outcomes. I want to improve the health outcomes of our nurses so that they are better able to serve the community, be it making sure we're adequately staffed, making sure that we have the facilities for their home visits so they don't have to use their personal vehicles, just anything that the nurses need. I want to meet that need so they can give their very best.
I think I'd probably want to have a program developed that would address every need that our patients have. Resources sometimes can be scarce, so mental health in particular is something that we're often missing with our patients, and so I'd love to be able to just devise a plan for them that addressed every need that they had.
For our communities where there's so much violence and there's issues of safety and people are not feeling safe getting out of their homes, that having safe parks for them to go to and take their children to, having access to nutritious, affordable food, I think is really an important thing. So that feels like a whole systems change that needs to happen.
My ideal service to the community would include universal home visits for all newborns, first time, fifth time, I don't care, and better backup so that when we make referrals, for example, for psychiatry or psychological counseling or a specialty clinic, that the problem can be attended to in a timely manner.
We have 6 case managers managing the whole caseload in Alameda County. I do think we need a more of a multidisciplinary approach to the program, which means to meet the client's need, we need an additional social worker or maybe public health investigator to contain the contact investigation.
My biggest fear right now is what I sense of the privatization of public health. That I think that concept is of the public health is for everybody.
My greatest fear is that the nurses won't be there for the generations to come. I'm the product of a public health nurse coming to visit my mom, who did all of the things that the nurse had explained to her, and she took it to heart and she shared those things with her kids. So I want that service to be here for those families that need it. That's my greatest fear. So I'm working to make sure that public health nurses will be here for generations to come.
At the end of the day, when all is quiet, nurses know that a child received protection from a deadly disease. An outbreak was contained. A preemie transitioned from tube feeding to breastfeeding. A traumatized new mom relaxed and enjoyed her baby. A child celebrated its first birthday. A senior is staying in his home. A family is staying together.